Good morning. As promised in my last video that I posted on vicarious trauma, we explored the signs of vicarious trauma in workers, in parents, in people who are just hearing friends talking about the COVID experience and the lockdown experience, not just healthcare workers and first responders. So today I want to talk to you a little bit about what to do if you think you're burnt out, if you're experiencing vicarious trauma. One of the first things that people often do when they're experiencing vicarious trauma, often before they even recognise it, is withdraw from their social contacts. They feel overwhelmed, unable to speak again to another human being, and so they withdraw from family, from friends. In doing so, they're withdrawing from the very thing that might help them cope better. So do make time for family and friends. It might not be a lot of time if you're very busy and overwhelmed with the demands of your work or your role, but you can take half an hour or an hour, go for a walk with a friend, have a cup of coffee, throw a ball with a dog, do something like that that is not going to expose you continually to the vicarious trauma or thoughts of the vicarious trauma, but going to give you some relief. So practice some community engagement, cuddle a pet, explore a hobby, allow yourself to cry, allow yourself to laugh. Take some time for reflection. Think about what's going on, what you're doing. Perhaps keep a journal. Go and try and get some regular sleep, develop some good sleep hygiene, which we can talk about in another cast. Eat healthy foods, but also eat food that you enjoy. If you really like smoked salmon, go buy yourself some smoked salmon. Whatever it is, do it. Make sure your health is good, have regular medical checkups, but most importantly are those psychological and emotional things. Practice some self-love. Acknowledge what you're doing, how you're helping others. Acknowledge how you can support other people. Practice forgiveness. Forgive the world. Look for things to be grateful for. Look for opportunities to be thankful. If you have a faith base, then turn to your faith base. Connect with your spiritual community. Go spend time in nature. Enjoy spending time in nature. Allow yourself to sing, to dance. Spend time with your family, as I said before. Read a book, but don't read a book about trauma. Don't read a book to inform you about how better to cope with this trauma. Rather, read something light. Read something I refer to reading the trashy novel. It's probably akin to watching something on Netflix that is not educational, not related to trauma. So if you're a person who works, for example, with people from sexual abuse backgrounds, then don't watch a TV show or read a book about sexual abuse or watch a movie about that. Historical drama is a good thing. Even crime set in history can be good because it's not an immediate relevance. So you're able to distract yourself. Most importantly, learn to say no. And it's not to say no to friends or family who are trying to reach out to spend time with you or support you. It's saying no to hearing more trauma. It's saying no to taking on more trauma burden. So learn to say no while you make times for you and times for your family and friends, or you're not going to be able to keep going on. You're not going to be able to keep supporting those who need your support and who you want to support. So take care of yourself is your first priority. If you're not okay, they will not be okay. Recognize when you're burnt out, recognize when you're overwhelmed, and take steps to connect outside of that burden. Take steps to look after yourself. Take care of yourself as we all should. God bless. Have a good day.